So we've had a few more kind of biology of the virus questions that are related to that conversation. One of them is, do any of you know about when do you become infectious, and how is that related to when you show symptoms, if you are going to become a symptomatic illness of COVID-19? We know that people can be transmitting virus before they show symptoms, but have any of you heard when, the timing of that? I have not, to be honest.
Yeah, my understanding where they've tracked, I guess, some studies in Asia where they were able to track the full course of the virus shedding from people who were exposed, that it actually looks like the peak kind of shedding is prior to the onset of symptoms or at the very beginning of symptoms.
Mild
after you've had
symptoms.
it for even 10 days or so, actually your infectiousness starts to decline even while you're still very sick. So I mean, that's, a blessing and a curse. It really is these early days when you would least suspect it, that you're going to be most contagious.
I think Lindsay Leininger, our fellow nerdy girl, posted on the incubation period and the infectious period a while back. So that post is up on Facebook too.
Okay, I'll see if I can track that down and post it in the comments.
I think it actually peaks at the very first days of symptoms for symptomatic people.
And that's really important to why this infection is so transmissible, right? Because compared to something like influenza, where I think the period in which you're transmitting is when you do have symptoms primarily, in those sort of like 2 to 4 day range post symptoms, when you're likely to be staying home anyway. That is a difference between these infections, and why it's challenging to identify people and to isolate people with this infection.
Yeah, that's why that and the asymptomatic infection that are still contagious are the reasons that it's so hard to do outbreak control just by telling people to stay home if you're sick, right? That's the typical advice for influenza, and that advice actually works pretty well, but that's because influenza is very rarely asymptomatic, and you're infectious when you're feeling sick. So